Indeed, it was another significant milestone towards the achievement of a functional and effective healthcare systems delivery within the Plateau with the inauguration of the State National Health Fellows in Plateau State. This historic event took place during the one-day state engagement on the sector-wide approach initiative under the leadership of Dr. Morina Bena Sonwar, the Plateau State SWAP Desk Officer. This one-day state engagement on the Plateau had in attendance the Executive Governor of Plateau State, His Excellency Barrister Caleb Manasseh Motfwang, ably represented by the Deputy Governor of Plateau State, Mrs. Josephine Pio. During this historic event, the Governor stated that the sector-wide approach SWAP initiative is not just a concept but a visionary initiative of the federal government aimed at turning around the fortunes of the healthcare system by unifying the sector based on the 5 core principles and pillars of the initiative, which is 1 plan, 1 budget, 1 report, 1 conversation, and 1 voice. The governor was optimistic and excited with the initiative and expressed his gratitude to the administration of His Excellency President Bola Ahmed Tinubu for the giant steps taken with the inauguration of the 774 young Nigerians into the National Health Fellows Program, where there are 17 persons representing Plateau State and the local government areas where they are to champion health advocacies and drive the desired positive change in their various community. In a similar tone, the Commissioner for Health, Dr. Nicholas Bamlong, stated that the SWAP is not just a policy initiative, but a strategic call to action that addresses our common health challenges with more focus on reducing maternal and newborn mortality rates, deploying the SWAP Maternal and Newborn Mortality Innovative Initiative, MAMI. The Commissioner thereafter called on all stakeholders to put hands on deck towards ensuring the success and swift implementation of this initiative on the Plateau. The SWAP Desk Officer, Dr. Morina Bena Sonwar, while delivering her presentation on SWAP, reiterated the core objective of the initiative, which is the improvement of health outcomes through a unified health system where the combined actions of policy and man bring about the desired impact. That is, the MAMI and the National Health Fellows shall be used to impact the project.
First time ever in Nigeria, we've been able to develop an annual operational plan in the health sector. Now, what this means is that for the first time in Nigeria, all health systems have one plan. Now, when we have one plan, you cannot deny the power of unity. When you have unity, you see that things work faster. So when we have one plan, execution means that execution is also going to be one direction.
One of the high points of this one-day stakeholders engagement program was the inauguration and presentation of certificates to the 17th State National Health Fellows by the Governor of Plateau State, ably represented by the Deputy Governor of the state, Mrs. Josephine Pio. Notably, were the plethora of goodwill messages from the dignitaries and stakeholders present. The Bongwan Jos, Da Jacob Boba, represented by the Adagwan Zere, was not left out. Other dignitaries present were Honorable Nambol Nambolistics, the Chairman, House Committee on Health, who also represented the Honorable Speaker of Plateau State House of Assembly, Right Honorable Gabriel Ndewan. Honorable Kemi Nshe, representing the Algon Chairman, Mr. Alex Gomdang, Chief of Staff to the Deputy Governor, all directors from the State Ministry of Health, head of agencies, chairman of local government, traditional rulers, partners, and a host of others. Indeed, Plateau State is truly aligned with the unified federal frequency for delivering a functional and effective healthcare solutions, the Sector-Wide Approach Initiative, SWAP. In Jos, Plateau State, I am David Alpha, reporting for DAP TV Nigeria.